Greetings and welcome back to the For Health Scholars channel. In today's video, we are talking about how to transition from the hospitality industry to becoming a healthcare administrator. And I'm going to give you some essential tips to help you get started today. But if this is your first time tuning into the channel, welcome. My name is Dr. Orobosa. Make sure to subscribe to the channel and turn on your post notifications. Each and every week, I give you videos that really helps you become a great leader in the business of healthcare. So without further ado, let's jump into the video. So as I stated, today's conversation is all about how to transition or pivot from the hospitality industry to becoming a healthcare administrator. And this question came from one of our viewers. And so I always like to answer the questions of our viewers. And I felt like this question was a great topic to create a video around. So here we are. How do I transition into a healthcare administration career? I'm currently working as a waitress, but getting my bachelor's degree in healthcare administration. And I'm here to tell you the pivot is possible, but a lot of the skills that you acquire in your profession under the hospitality industry are skills that can be transferable and applied into the healthcare administration industry, because both fields is all about serving consumers. So when we think about you working in the hospitality industry, whether it is a waitress or all of the different roles that fall under hospitality, I find that customer service is king. The goal is to ensure that the patient is happy and that they're willing to return back to this restaurant, to this resort again and again and again. And not only return, but tell somebody else. And this is how business grows. So as a professional working in the hospitality industry, you need to have good memory skills, especially as a waitress, as one of our viewers are. She's a waitress. So being able to take orders and remember orders is important. Handling money is important, and being good at calculating money. Excellent active listening and verbal communication skills, as well as the desire to want to help people. And in the healthcare industry, I also find that customer service is king. Our goal is to ensure that our patients return back each and every time for their healthcare needs. And so as a healthcare professional, regardless if you're on the clinical or administrative side, you have to be good at analyzing data. You have to be good at solving problems. You have to be good at working in a team. You have excellent active listening and verbal communication skills, and you too have the desire to want to help people. And what we found thus far between two industries, hospitality and healthcare, is that there are some transferable skills that can be applied to both industries, whether you're transitioning out of healthcare into hospitality or vice versa, from the hospitality industry into the healthcare industry. What's going to help you make that transition smooth is the way you use your skills and articulate it to convince the hiring manager for this new job in the industry of choice why your skills can be greatly used in this new industry. And so today I want to provide you with 5 tips on how to use your hospitality skills to land your first or next healthcare administration job. So the first thing that you need to have under your belt in order to become a healthcare administration professional is education. Because we are in the business of serving patients at our greatest point of need, this industry values professionals who have formalized education under their belt. So a bachelor's degree, master's degree, and even doctorate degree can be helpful to you, as well as industry certifications. And the video I posted earlier on this week, it also talked about certifications. And so if you are interested in that, you can catch the link up here somewhere or in the description box below. So education is the first skill that you need to develop on. So if you are working in the hospitality industry and using that money to help you pay for school, that's a great step. Because in healthcare, formalized education is a standard. I'm not going to sugarcoat it for you. You have to have some type of formalized education under your belt to work as a healthcare administration, management, or even public health professional. Then the next thing that you need to have under your belt is learn the industry. And so many people undervalue the importance of learning the industry. On a day-to-day basis, you should be reading editorials or scholarly articles about what's happening in healthcare. You should be learning about the gaps in the industry. You should learn about the strengths of the industry and becoming familiar with the industry experts and scholars, because you're transitioning from a service-based industry that you probably was not exposed to healthcare practices on a day-to-day basis. So when you're transitioning into the healthcare administration field, and this is such a leadership position to manage something which in hospitality you're managing as well, depending on your role. But learning how to manage people effectively, the only way you can do that is learning the industry. Become familiar with the terminology that we use in healthcare. Particularly, we have our own language. And you, as a healthcare professional, when you go to do your formalized education, you may take a class that is named medical terminology. That is teaching you the language in healthcare. The same way you have your language in hospitality to communicate customer orders, to communicate how you're going to operate in the hospitality space. We have that in healthcare, and that should not be undervalued, because our core goal, whether we are administrative or a clinical professional, is to be supporting the organization to deliver quality, safe, effective, patient-centered, efficient, and timely healthcare services. Then you need to decide on what area under the healthcare administration umbrella you want to work in. Because to say healthcare administration, there are so many different sectors underneath that. So you have operations, you have policy, you have manufacturing and supply chain logistics, you have pharmaceuticals, education, you have insurance and managed care, public administration, environmental services. The list goes on and on. So when I see individuals that say, "Oh, well, I want to work in health administration, I need to get a job," the question I'm asking you, okay, what part of the healthcare administration sector do you want to work in? And they're like, yeah, this is an industry that you must know like the back of your hand. And as you learn about the industry each and every day, and you're reading information, even if it's not each and every day, because I'm very passionate about the business of healthcare. Like, this is something I believe I was called to do, to be in the industry as a business professional. But that may not be your passion. Maybe you're just like, I want to work here. But I find that healthcare employees, no matter if you're clinical or administrative, you have to have some form of compassion and the desire to help people, especially people who are our patients, who are really sick and needing us at their greatest point of need. So you have to decide what industry sector is right for you under the healthcare administration umbrella. Then packaging your skills. This is very important. This is going to take you from one industry to the next, the way you articulate your skill sets. So I'm going to break it down to you by section. Jobs. You find the jobs that are requiring entry-level experience or has similar skills ask as what you have been doing in the hospitality industry. And you may have been leadership professional in the hospitality industry, and now you're trying to come into the healthcare administration industry. And even on the healthcare administration, if you're working on the inpatient side, hospitality management is also needed. When we do catering, food delivery to patients, working with a nutrition team in the hospital to make sure patients are getting what they need. So your skills are definitely needed in the healthcare sector. But how are you articulating it? You finding jobs that may be similar. Maybe the way into the healthcare industry, and this is just an option, not a mandate, is that you find a hospitality job within the healthcare industry. They're always looking for hospitality managers in healthcare, especially at the inpatient or hospital side, skilled nursing homes, any place where you have patients there for long periods of time. On the outpatient side, may not need hospitality, but on the inpatient side, on long-term care side, yes. Someone who knows how to operate and manage hospitality staff, someone who knows how to execute high volumes of food orders. So your skills are definitely needed and can be used in healthcare if you're coming from the hospitality industry, but it's about packaging. Resume, instead of using a chronological resume, use a functional resume that more focuses on your skills and expertise versus your work experience. Okay, so there are different types of resumes, and I have a video, check it out in the description box, that tells you how to write a hiring manager worthy resume. Network, no matter what industry you go to, but for you, coming from the hospitality industry, do know that networking is also important. So attend and participate in healthcare industry driven events. Speak to people. The healthcare industry is not an industry where you can operate in a silo. Absolutely not. It is a human capital driven type of industry. So people depend on people to get things done. So you need to talk to people who can help you get your foot in the door. Gain experience, volunteer, leverage your intern or externship requirements from your degree program if you are working in the hospitality industry, but also going for your bachelor's, master's degree, or even doctorate. It's very rare, but I'm just putting everything out there. Gain experience, volunteer, your externship, internship, connecting with the decision makers, then become an expert in the field. And this day and age where we have social media, just LinkedIn. Maybe you're using your LinkedIn page to operate business, but you're using your LinkedIn page to help you put yourself out there. And I say LinkedIn because LinkedIn is a professional social media platform. Share your thoughts of what's happening in healthcare. Share an article, ask questions, contribute into the industry via writing. There's so many ways to be an expert in the field and not necessarily have to go out there and be recruiting people and speaking from a public space or managing a page. If you follow me on LinkedIn, you don't have to do what I do to be an expert in your field. You could just share tidbits of information that people value. Because once again, the healthcare industry is a human capital driven industry, and it's all about information sharing, knowledge exchange to help solve the greatest problems that we see in healthcare, to deliver quality healthcare services to our consumer in healthcare, which is patients. And then apply, apply, apply. So many people are afraid to apply. The only way to get a job in the healthcare industry is for you to apply to different positions. Now, how you apply varies. Maybe you're not filling out an application. Maybe you're emailing a hiring manager. That's still a form of application. Apply, apply, apply. Put yourself out there. Keep applying. The law of large numbers says the more you do something, the higher possibility you have of attaining it. The more you apply for jobs, eventually one will call you, but it takes time and there's a strategy. So definitely watch Writing a Hiring Manager Worthy resume video, watch the How to Write a Cover Letter video, watch how to land your first job in healthcare administration. We're doing things here at the For Health Scholars page. And then also accept and know that rejection is normal, but don't stop. Don't let that stop you from saying that this industry is not right for you. If you desire to be in healthcare, you will get into the healthcare. And it takes time, a process, and a strategy to get in. And definitely join communities like this, the For Health Scholars page. So these are the tips that I can give you. And if you are like, I need more, I love this, then we have a free guide that is titled From Healthcare Graduate to Hire. And it's giving you important steps to help you land your first or next healthcare administration job. It's free to you. Download it. If you have questions, ask. But I promise you, this is the tools and resources that's going to help you position yourself in this industry. So that is all that I have for now. Make sure to like, subscribe, and share. And I'm wishing you all the best in your career pivot from hospitality into healthcare.